I'm Dave Beck. I'm a partner at Eganberger Weiner, and my focus is primarily on insurance services, and I've been in the financial services industry for over 35 years now. For those of you who don't know me, I consider myself to be a youthful 60, which may be true, but my claim of a millennial may not be. As I look today's topic, it is one that is poignant to me and my wife as we have begun planning for our later years, as we have reflect upon the struggles that my parents went through. My parents' situation is one that could have been avoided if they had done some advanced planning. Their desire to remain independent actually cost them their independence because their limitations made the decision for them. I encourage all of you to make a plan for later years, and today's webinar can be the beginning of a solution for many of us. Now, I'd like to introduce you to Lindsay Hutter, Chief Strategy and Marketing Officer at Goodwin Living. Lindsay's focus in her role allows her to combine her passion of seeing elder Fairfax residents find purpose. Lindsay's career has included a variety of management positions. She achieved her bachelor's degree from the University of Kansas and her master's degree from Northwestern University. And without further ado, here's Lindsay.
Thank you so much for that gracious introduction, and thank you to all of you who are taking time to watch this webinar. You are doing yourselves and your loved ones a great favor because you're getting informed about all the different options for you to have a great next season of life and to be prepared for that. It's my pleasure to represent the nearly 1,200 individuals that serve at Goodwin Living and support, honor, and uplift the lives of older adults. And I want to tell you a little bit about our organization so you have a context for the information and the perspectives that I'm going to provide. Goodwin Living is a faith-based, not-for-profit organization. We were founded in 1967. We like to say that we come and we stay. We are firmly planted here in the National Capital Region, and we have a wonderful array of services that I want to tell you about. For now, let me share with you our mission. It's to support, honor, and uplift the lives of older adults and the people who care for them. Our vision is to expand the ways and places we serve older adults. We know that as a consumer, you might want things your way, not just a cookie cutter way. And so we continue to innovate and expand new services and new ways to deliver those services. As I mentioned, our organization is faith-based and we're not for profit. Being faith-based means that we welcome people of all faith and cultural traditions and worldviews. And as a nonprofit, it means that every dollar we generate goes right back into our mission. There are no shareholders who receive 20 or 30% of the profits when we have a successful year. They go right back into the mission of the organization, serving our residents, our members, our patients, and our team members. And finally, we have three goals as an organization. The first is to be a provider of choice for services to older adults. The second is to be an employer of choice because we want the very best talent to care for those older adults who are in our service and care. And finally, we want to be a champion of social good. That might be an unusual term for you, and I'm going to unpack it in just a moment and show you how we try to take what we've learned and share it with others so they too can be in service to older adults. So let's transition to our campuses. Goodwin Living is fortunate to have 3 senior living campuses inside the Beltway. We have Goodwin House Alexandria, that's in the west end of Alexandria. We have the View Alexandria, which happens to be just across Beauregard from Goodwin House Alexandria. And then we have Goodwin House Bailey's Crossroads, which is over in the Falls Church part of Fairfax County. And Goodwin House Alexandria and Goodwin House Bailey's Crossroads are what are called entrance fee life care communities. And that means that residents prepay an entrance fee, and that entrance fee essentially locks in their monthly service fees across all levels of living. So they would move in independent living. And then if their needs changed, and at some point they might need to transition to assisted living or healthcare, essentially their monthly fee stays the same. And it's that entrance fee that is the prepayment. Both those two communities are the full continuum of services. Residents would never need to move out of the community if their care needs changed. The View Alexandria is a rental community, and there are some who prefer, or it's a better financial model for them, to simply pay a monthly fee for all of their services. That community has independent living, assisted living, and long-term care. So those are the three campuses. Overall, we serve about 1,100 older adults across those three campuses. We also have a series of healthcare services. And these are services that our residents receive as they need them. They're also services that we deliver all across the Northern Virginia region. And that allows us to provide them to older adults who might live in other retirement communities that don't have these services. And we deliver them to older adults who said, I love my home. I love the neighborhood where we raised our family or I've lived for many years. This is where I want to age in place. And so we bring the services to the older adult. There are 4 services outlined here. The first on the left is Goodwin Living at Home. And that's like an entrance fee life care service in that you prepay a membership fee, and that supports when you need, and it's financial coverage for when you might need assisted living or skilled nursing or healthcare. We also have a care coordination component around that. So our Goodwin Living at Home members, when they have any health needs, major needs, we have a member services facilitator who's helping coordinate what are the medical needs. If you need to be in the hospital and then discharged to a rehab center, they're helping with all of that coordination. Next is Goodwin Home Health, and that is a Medicare certified home health agency, which brings assistance and support to older adults who maybe have had an accident, a fall, surgery, and they're not yet ready to continue with that independent living they had before the incident. Home health can come around that and support them with activities of daily living and some light exercises and support to help them get back and transition back to independent living. Goodwin Rehab, that is a rehabilitation service with expertise in Parkinson's, speech therapy, occupational therapy, and many others. And we provide it to our residents. And we also have outpatient rehab. You could be living at home or elsewhere, and you can come and receive your rehab services. And that outpatient rehab center is at the View Alexandria campus. And finally, we have Goodwin Hospice. Hospice is a wonderful service if you've not experienced it for a loved one in your life. And it is eligible with government funding for individuals that have less than 6 months to live and are no longer involved in active treatment to sustain their living. And Goodwin Hospice is a service that's provided to older adults all across the region. We're grateful to tell you that we received the highest of the various ratings and rankings in the quality of Goodwin Hospice for all the hospices here in the Northern Virginia region. And as I said, these services are available to older adults all across Northern Virginia. And there are other providers who also provide these services. We encourage you to familiarize yourself with these services, what they are, and when you might need them. So again, you're prepared. Now, I mentioned that a third goal of Goodwin Living is to be a champion of social good. And there are 3 ways that we're a champion of social good on this particular slide. One is to be really intentional about the necessity of a strong talent pipeline for our region. So we partner with local universities and colleges to make sure that they have the faculty capacity to take as many students as possible. We also have a brain health program called Stronger Memory. And thanks to the generous donors to the Goodwin Living Foundation, that is available at no cost on a complimentary basis on our website. And you can download the brain health Stronger Memory materials to help keep your cognitive health as sharp as possible. That's going to extend your independence and your quality of life. And then the third example of being a champion of social good on the right is our citizenship program. Goodwin Living has a unique program where we fund the citizenship application fee, which is $725 for all of our team members and their immediate family members. And our residents provide tutoring so they can prepare for the citizenship exam. This is significant because about 1/3 of the employees in the field of senior living are immigrants. And we want those immigrants to be able to become American citizens. And we're delighted to tell you that almost 200 of our team members have earned their citizenship through this program. So let's focus on you for a minute. And I want to context this in Maslow's hierarchy. And for older adults, the senior living and healthcare services field really needs to come around you with three things. One is housing, one is healthcare, and the other is socialization and purpose. So let's dig into those for just a minute. For housing options as we age, there are actually a lot of options. You have your home. There are independent living communities, which are kind of like apartments or condos, but it's just purely independent living of older adults. You often hear them called 55 plus. There are communities that focus on assisted living, some communities that provide assisted living and memory care. Then there are some skilled nursing centers. That's their expertise, skilled nursing. Then you start to see there's some that combine several of those levels of living. And then the full continuum, and that's called a continuing care retirement community. That's going to have independent living, assisted living, memory care, long-term care, and skilled nursing, all on one campus. So you see, you do have lots of options. And again, it's important to visit some of these different types of communities to learn about them, what they offer, and what are the financial fees. Now, if we shift to healthcare, for older adults, we really want to have this, if you will, ecosystem of services that's there to come around us. And the graphic that we have in the lower right shows you all the different types of medical professionals and service providers that are important to have in your Rolodex or your iPhone contact system. We're going to send you this deck. You can see it and you can take notes on, okay, do I have a post-acute care practice partner if something should happen to me, if I have an accident, a fall, a surgery? My primary care physician. Go around that circle and you see all these different individuals. And it's very important to you that you know some of these providers. So when the time comes, you're not having to do your research to say, gosh, I all of a sudden need a home health agency. Who's good? Which one? Because when something happens, you really don't have time to sit and do a lot of research. You need to know one of those services in advance. And a little bit about those services. I think it's helpful to understand what is a private pay relationship, where might insurance provide coverage, and where might government through Medicare provide coverage. So this chart shows you that private pay is a factor in all of these relationships. Depending on your insurance, you may not have home care provided. And a lot of people think that, oh gosh, if I need someone to come in and just help me with some of the activities of daily living, a home care agency, Medicare or Medicaid will pay for that. Well, no, actually they won't. And that can get really expensive because in the case of home care, average fees can be $35, $40 an hour. And that adds up several hours a day, several days a week. This is one of the slides that's really important to review with your financial services advisor because it will help you understand what are some of those services that I may need to pay for on my own that insurance isn't going to cover or government funding won't cover. And that helps you with your financial planning. So very important, again, to meet with your financial advisor and study this. Now, the third part of Maslow is for older adults anyway, is the socialization, purpose, activities. That's really, really vital. Think about it. When you have a purpose in life, you want to get up in the morning. You want to be engaged. And sometimes this gets minimized. We don't prioritize. How will I continue to be active? What are my purposes going to be as I age? Very important consideration. So Maslow for older adults, what are your housing considerations? What are your healthcare considerations and that system, that network of people and resources around you for that? And then finally, what are the ways that you're going to continue to be active and social in life and have purpose? I'm going to transition to something that you might not think is necessarily important in your research, but you're going to find out that it's vitally important. And that's population trends in terms of more and more older adults in our country. 10,000 people turn 65 every day. Think about that. 10,000 people turn 65 every day. And what that means is that there is more and more demand for services that you may also have a need for. At the same time, birth rates are declining, and we have fewer and fewer young people. I'm going to give you a graphic. If you can see my hands, this is an inverted pyramid. And what it means is increasingly our nation has more older people than it does younger people. And that's the first time in history. So let me share with you a quick slide. This is looking at population growth in Northern Virginia of older adults. And you can see that from 2010 to 2030, we are going to more than double the percentage of older adults in this region. So that means that there are going to be a lot of people competing for services, whether it's senior housing environments, healthcare services, or ways to stay socially engaged and have purpose. And that definitely has an impact on your research into providers, whether that's senior housing providers or healthcare providers, because you want to know that they have wonderful professional top talent and that they retain their talent. That's very, very important. You might not think about that as a question when you go research senior housing environments to say, gosh, tell me, what's the turnover rate of your team members? Slides like this are why you need to pay attention to those issues. Well, I'm going to throw a couple of stats at you. And if you're home and you're listening to this, you'll see this number 70% pop up. And you may be thinking, 70%, what does that mean? What it means is that 70% of older adults today who are 65 and better are going to need long-term care. So you might be at home with your spouse. You might be listening to this with 3 or 4 of your friends. Look around the room because most of you are going to need long-term care. That's why it's important to understand those payer models. And let me give you one more statistic. 20%. Thinking, well, what does that mean? Here's what it means. 20% of older adults who are 65 and better are going to need long-term care for 5 or more years. It's a pretty sobering number. 20% are going to need long-term care for 5 or more years. Now, the good thing is we're living longer, and older adults have a lot to give this world. So we are grateful for the fact that older adults are living longer. We're also very attentive to the fact that we need to be able to fund that long-term care. So one more statistic, this is really important. As we have more older adults, we have an inverted population pyramid because there are fewer younger adults. This is a chart that's showing you what birth rates have done. Stopped at 2015, but what I can tell you is birth rates have declined in this country, and actually they're declining at a faster rate than had been predicted. And it's the same for much of the world. So we have a situation where we have more older adults and fewer hands to care for. And that's a term that our CEO, Rob Lieber, talks about often. There are fewer hands. So what do we do about that? Well, we plan ahead. And that's what you're doing today by attending this workshop. And it's really important. And what I'm going to do is give you an overview of a few types of living environments that you can plan ahead for to put your name on a list. Get on those proverbial lists right now. They're usually very low commitment and they refund whatever the fee is to join the list. And it makes sure that you've done your research and you have your name in a place in the event that you might need. Now I'm going to give you an overview of a rental campus. This happens to be the View Alexandria by Goodwin Living. We acquired this in 2022, and it is our first rental community. So typically, what's involved in a rental community for older adults? It's going to be a rental contract. You're not obligated to deliver a big entrance fee or membership fee when you join. It's month-to-month fees. And in the case of the View Alexandria, it has independent living, assisted living, and long-term nursing care, all on the same campus. And it also provides you the skilled nursing at our nearby campuses. In addition, because we have all those healthcare services, you can access rehab, home health, hospice, all on this campus. That's a convenience, and it's something to ask when you're researching senior living communities. Do you have rehab? Do you have home health? Can I access those if I need them on this campus? We find that it's really disruptive in life as we're aging to all of a sudden need services and a higher level of living, and they're not available in the place we live. And then we have to move when we're probably least interested in moving. This is an example of fees, and I'm going to show you independent living fees and assisted living fees. And they're fairly typical for what you will see in a rental community that is what we call mid-market. Now, there are some rental communities that are very, very high end, and their fees will be 2.5 times what you're seeing here. This is going to be sort of a mid price point. So for independent living, we have studios, and they start at $4,369 a month. 1 bedrooms are a little more, 2 bedrooms are a little more. Most retirement communities are going to have a second person fee, and that's what the second person would pay on a monthly basis. Then you see that there are tiered services. So let's say you move in at the assisted living level, and you might need a little additional help. And those fees can range from $588 a month to $4,715 a month if you need the highest level of tiered support. And then finally, you will find that rental communities have a one-time community fee. So you pay it once when you move in. Our one-time rental fee is $7,510. Now, what are some of the benefits you receive? So for that rental contract, you're going to receive 3 meals a day in a dining venue. You get weekly housekeeping, laundering your towels, your sheets, changing bed linens, vacuuming, and so forth. Your utilities are covered. You have complimentary transportation to medical appointments that are within a 10-mile radius. Also complimentary transportation to nearby shopping centers. Home maintenance. Something happens in your apartment, pick up the phone, and facilities comes, and you're going to take care of that issue. You don't have to worry about it. Cable TV and Wi-Fi, reserved parking. And then, and this is really something that most adults look forward to so much, it's right there in the convenience of your community: classes, lectures, concerts, all sorts of programming, which contributes to your socialization, your cognition, your exercise, your fitness classes, wide variety of activities. That's what you should expect to see with a rental. So now let me shift to Goodwin House Alexandria and Goodwin House Davis Crossroads. I'm going to give you an overview of what are called life care or entrance fee communities. So at a life care or entrance fee community, you're going to have quite a bit more resource. So about triple the amount of programming that you would have from a rental community. A lot of lectures, experts coming in, musical performances. You're also going to have an on-campus clinic that is there for you to be seen by nurses, the doctor, when our doctor is at the clinic. And yes, we do have relationships with the Virginia Hospital Center, dedicated geriatric physicians who are coming in and out of our clinics. We have art centers and art galleries. You can see some of the artists at work, and then a wide variety of fitness, art, all types of classes and programs. So at a life care community where there's an entrance fee, you're essentially paying an entrance fee that is prepaying for your healthcare costs. I'm going to explain this model. And it's called a standard life care agreement. And what it means is when you move on that campus, you have guaranteed access to healthcare. And you have peace of mind for you and your family. What is that peace of mind? It's that if you need a higher level of living, it's there. You do not have to move to another retirement community to find that additional service and level of living. It also means you have a predictable path for the cost of living, because an independent living fee is less than an assisted living fee, and an assisted living fee is less than a healthcare fee. With a life care contract, you're essentially locking in the monthly fees at the beginning when you move in. And then finally, you have tax savings, because the percentage of your entrance fee, percentage of your monthly fees that's going to medical care, that's tax deductible. So let's dive in and look at this a little more closely. What you see on this chart is the illustration of a life care contract, and we're using independent living as an example. So you see that a 1-bedroom apartment entrance fee might be $229,510. And at the point of signing that contract, you're going to pay that entrance fee, and then you're going to begin paying a monthly fee. And that monthly fee is connected to the apartment, size of the apartment. So if you came in and you had a 2-bedroom apartment, you'd have a higher entrance fee and a higher monthly. But in this case, we're using a 1-bedroom apartment as for example. So you see the 1-bedroom entrance fee and then that life care monthly rate. All right, what does that give you? Well, immediately at the get-go, it gives you $393 worth of dining dollars. Those are dollars that you can use on any of the 3 dining venues at our life care community. There's 3 dining venues. You pick which one. Most residents never use their entire monthly allocation of the dining dollars. So that $393, we have a very, very low food rate in terms of food cost. So people can spread that out across a month and rarely will they use it. They receive weekly housekeeping, real estate taxes, utilities, home maintenance, and this is for the community itself, the landscaping, everything is all here. So you basically pay one fee, which is your monthly fee, and that's going to cover all of the services. Now, if we had an event at the Kennedy Center and you needed to purchase a ticket to the Kennedy Center for a play, you would purchase that separately. Otherwise, nearly everything is included in your monthly fee. Now, this is where it gets really interesting. I'm going to take a 1-bedroom apartment and I'm going to show you a 1-bedroom apartment and what would happen if an older adult moves from their independent living to assisted living and what the monthly fee is. But I'm also going to show you what the fee would be if they came in to the community at the assisted living level. So as an example, let's take a $253,000 1-bedroom apartment. That's the entrance fee. And their monthly fee is $3,392. Now, if they move to assisted living, their monthly fee is going to go up by just about $400. And that $400 is a requirement of 3 full meals a day, and that is a government requirement. So we're simply passing through what the government requirement is to provide 3 full meals a day for assisted living. But there's no other change in that monthly fee. Now, let's say someone contacted one of our life plan communities and said, I need to move in and I need to move in at the assisted living level. $7,843 would be the market rate for their monthly fee. Now, for the resident that came in at the independent living level and paid that entrance fee, they're paying $3,774. And that's a savings of $4,069 a month. Now, let's say someone lived in assisted living for 2 or 3 years. you calculate that savings over 2 or 3 years, and you've more than paid for the entrance fee. Plus, you've got all the benefits of living on campus, and you have that guaranteed access to move to a higher level of living. That's why some people say, I'd really like to choose that life care contract, because I'm prepaying for those future costs. I'm essentially locking in my monthly service fee rate. That's why they choose that life care contract. Now, let me play this example out over someone who comes in at the healthcare or nursing home. So if we, again, go back to our individual who moved into a 1-bedroom apartment, they paid $253,920 for their entrance fee. When they joined the community and independent living, their monthly fee was $3,392. And let's say they need to move to nursing. They go from independent living to our healthcare center where they're going to get nursing care. They're paying $3,774, same as assisted living. That's their monthly service fee. Now, let's say someone came in and joined the community at the healthcare center level. They didn't come in and live there for a period of time in independent living or assisted living. They came in and they needed to go straight to nursing and healthcare. They would be paying $16,124. That is a savings of $12,350 a month for the person that chose the life care contract. So again, a lot of savings over time by choosing the life care. Okay, pause for a second. Whew, that's a lot of data to capture. I now want to share another option for kind of a life care contract model, and that's for Goodwin Living at Home. It's called a continuing care at home program. And we've actually increased the number of members we have in Northern Virginia and DC. It's about 235 right now. This is regulated by the Bureau of Insurance of Virginia and the DC Department of Insurance, Securities and Banking. And it's very similar to that life care contract at Goodwin House Alexandria and Goodwin House Baylor's Crossroads. So it's essentially a life care contract for those who say, I want to live at home and have the care brought to me. So this program is really built for healthy, active older adults who want to stay in their home as they age. So it's not for someone who finds themselves in a crisis and they need care brought in right away and funded. It's for those who begin at an independent living level. And it's for those who say, I want to prepay for what may be my in-home care needs at some later date. This program, in addition to that prepay model, it also provides you with member services facilitators. And they're individuals who know you and know your health, and they're staying in touch with you. And as your needs may change over time, they're helping you access the services that you need to ensure that you can live safely in your home. And that may be bringing in a home renovation expert who's going to come in and put grab bars, who's going to help you make sure you have mobility access throughout your home. So there are the services to keep the home safe and then to keep you healthy. So what's included? Well, if you join Goodwin Living at Home, you're going to have a membership fee. It's that prepayment, and it's going to pay for your short-term and your long-term care future needs. There will be coordination of home maintenance for your health and safety, annual home safety assessments, and in the event that something happens and you decide or you need to move into assisted living or a nursing center or healthcare, you will have priority access right after Goodwin House Alexandria, Goodwin House Baylor's Crossroads residents to go to one of our health centers. This is really important. Also, you have portable benefits. After you've been a member for 1 year, let's say you want to move to North Carolina or South Carolina to be closer to family. Your Goodwin Living at Home benefits will transfer with you. This is a chart that takes a look at the cost of home care, assisted living, nursing care by day. And this is based off of data across Northern Virginia. So you start to see what would it cost if you wanted 8 hours of home care brought into my home on a monthly basis or on an annual basis. What would assisted living cost me if I moved into an assisted living community? What would nursing care cost me if I moved in? And pretty quickly, you realize, oh my goodness, if I needed 8 hours of home care in my home, it's almost $100,000 a year. If I move into an assisted living community, it's about $100,000 a year. And you see how much you really need to anticipate what the cost will be and why it's important to stay healthy. For Goodwin Living at home, 2 types of benefits to think about: the financial benefits, the coverage of those financial benefits. You see those on the left. And then what are the financial costs? There's a membership fee, there's a monthly fee, and then there's an inflation adjustment, which is going to be paid once a year. It's when we increase our monthly service fees. On average, it ranges anywhere from about 4 to 6.5, 7% each year in terms of cost of inflation. Now, wow, sobering to see those numbers, isn't it? That's why we focus a lot at Goodwin Living on the power of prevention. We know this: 30% of the American population is over 60 years of age. We know that about 12 to 18% of people who are 60 and better are living with some level of mild cognitive impairment. That's about 15 million. And importantly, we know that older adults that exercise are going to have lower blood pressure, a reduced risk of fall or serious injury, and a slower loss of muscle or bone mass. And when we look at that data and we say, oh gosh, I remember Lindsay talked about the fact that there are more older people, fewer younger people, it really puts an exclamation point on the importance of aging well. I mentioned Stronger Memory earlier. It is a complimentary program. You can access it. It's 3 simple activities every day for about 30, 40 minutes. Reading aloud, writing longhand, and simple arithmetic. We've been in partnership with George Mason University to do research on the impact of Stronger Memory. We continue to find that it is helping stabilize and in some cases improve cognitive capacity of older adults. If there are 2 thoughts that you take away from this session, it's engage in physical mobility and engage in cognitive activity. That's going to help you stave off the need for care. It's going to give you a higher quality of life, and it's going to keep your care costs lower. There's so much more to share. You can learn more at goodwinliving.org. We have a lot of resources, including Stronger Memory and our brain health programming. You can learn about us on these various social media platforms. And of course, we want to thank the wonderful firm that put on this session, and that's Egan Berger Wiener. And I'm now going to hand it back to really you all for any questions that you have, which I would love to answer. And I think Megan's going to field those. And thank you for staying with me. I know it was a long presentation. We want to provide you with the best information we can so you can be an informed consumer for how you want to direct and steer the next chapters of your life. Thank you.
Hi guys, thank you for staying on. We do have a few questions in my email. One of which was, are you going to receive the slides afterwards? We are gonna have a recording that will be on our YouTube channel, so you'll be able to view that way. We did have another question, which was, can one enter into a life care facility if they need assistance, or do they have to be able to walk in, meaning can they physically use their legs? Do they have to be able-bodied?
Really important question. So thank you to the viewer that asked that. So think about entering a life care or a continuing care retirement community based on the level of living. So if you move into independent living and you want that life care contract, you're going to need to be able to live independently on your own without any assistance in daily living. You then might be eligible for that life care contract, and you may choose that life care. If you have long-term care insurance, you may say, oh, that's doubling up. I don't need life care contract and long-term care insurance. So you might choose another contract. That really depends on A, do you medically and financially qualify to move in at an independent level, and what contract do you want? Now, let's say someone enters the community at the assisted living level. And so they've come in and we know they need some assistance with those activities of daily living. You can definitely move into a life care community at the assisted living level. You likely wouldn't qualify for a life care contract. So at that point, you'd be paying private monthly, in essence, kind of a rental fee to move into that life care community. Same thing for moving in at a healthcare or nursing home. When you move in, you wouldn't qualify at that point for a life care contract. The life care contract is only available for those who can engage in independent living. So that's an important question. And you might say, okay, so what does that mean? Well, I'll tell you what it means. If you think that that life care contract would be of value to you, you want to move into the community when you're still capable of independent living. That's how you're going to access that life care.
Thank you, Lindsay. We do have another question in the Q&A. It's an anonymous question. They want to know how long-term care insurance pays for any of this.
Oh, gosh. It's a really good question. And it is going to depend on your long-term care insurance policy. So that's the key consideration. What does your policy cover? And another thing, which is really important, when does the coverage kick in? Most long-term care insurance policies don't kick in until day 91. That can be a challenge if something happens and you might need to move into a nursing facility for a period of time. You had a fall, you had surgery, and you might not need to be in there for 3 months. You might need to be in there for 2.5 months. And if your long-term care insurance policy doesn't kick in until day 91, then you're subsidizing that. And I think that the averages across the region, for example, for nursing care were $15,000 a month. So 30+ thousand is going to come out of your pocket. I would suggest that you sit down with your financial advisor or one of the advisors of this firm and put up your long-term care insurance policy against the contracts of various senior living organizations. Be a planner, be a researcher. Go visit several senior living organizations in this region. Highly recommend that. As I said, our goal is be an informed consumer. So go to several different types. Go to a rental, go to a life care contract, get their agreements, sit down with your financial planner and walk through what are the different options. Have your insurance agent with you. If you have that long-term care insurance, think of it as your team of experts that you want to bring around the table and say, okay, everyone, let's look at my long-term care insurance policy. Let's look at my financial assets, my savings or my pension or income, and let's determine what's the best for me that's going to make sure that I live well, I'm cared for well, and I have assets to cover my care needs.
Thank you, Lindsay. And speaking of contacting your financial advisor, I just want to point out that both Lindsay's information as well as the info@ebw email are on the screen. So if you have any further questions, absolutely feel free to reach out. We want to keep you guys as informed as you can be. I don't see any other questions. If anyone
Are there any other questions?
Additional questions, now's the time. We'll hang on for maybe another 30 seconds or so, see if anyone's typing.
There are no bad questions. There are only bad questions if they're not asked. We just so encourage older adults to engage in the plan and get out there and learn and visit communities and talk to your friends. You know, maybe your friends have visited communities or are living in a community, and have a conversation with them. Inform yourself and act sooner rather than later. because that's what allows you to decide what you want. The longer we wait, the fewer the options that we'll have, because our conditions will change. And when our conditions change, we have needs. And then we have to say, who can accommodate my needs? Can I afford to live in that community? So prepare. Good advice.
Yes. Okay. So I don't see any more questions coming in. Thank you everyone for joining us today. Please stay tuned as we'll have more webinars coming up throughout the year. We are adding more webinars and adding more events throughout the year. So we are excited to see you guys and help you guys learn and grow through your journey. So feel free to tune in. And if you have any questions, definitely reach out to us, info@ebwllc.com. I can give you definitely a full list of what we're looking at. Thank you guys.
Thank you all. Be well. Thank you, Megan.
Thank you, Lindsay.